based on the stages and based on patients' symptoms and the conditions, we actually tailor the treatments according to the need. In the mild and minor cases, most of the time they just need rest. So don't squat, don't go up staircase too often, and then stop the sports activity. Just do a normal walking and then get rest. And if it's very painful, if it's swollen and warm, the knee, you can put an ice pack over the knee to reduce the swelling. And if it's really still very painful, you can actually take some painkiller. Other than this, in severe cases or in advanced disease or moderate disease, during their bad days, they can actually use a walking aid. The rest and walking aid can help for the initial painful period. So usually in osteoarthritis of the knee, the pain will come and go. So they will come in a few days, bad days, you're really painful, then you get away, and after 1 month or 2 months, they come back again. Before the knee replacement operation, we can actually offer intra-articular knee injection. Intra-articular knee injection means we inject medication into the knee joint space. So there are various kind of agent can be injected. One is corticosteroid, means it's a steroid. It helps to reduce inflammation in the knee joint. But it's not advisable to inject so many times, because in long term they can cause further thinning of the cartilage. The second group is, we call it hyaluronic acid, or HA. So HA is actually a collagen similar to our joint fluids. They can provide some lubricants, anti-inflammatory effects, pain relief effect. They try to mimic the joint fluid function to provide with reduce in pain. The third group, we call it platelet-rich plasma, PRP. So PRP we tend to use PRP in the younger patient because younger patients have a potential to regenerate faster compared to elderly. These are a few things that you can consider before you actually make a decision to do a knee replacement therapy. Of course, the ultimate treatment, which is proven or until now, is knee replacement therapy. We try to remove the damaged structure, the thinned out cartilage, and then we use metal to cover the bone end. And then the other end of the joint, which is also the same, we try to remove a few of bones and also the damaged cartilage. Then we try to cover with the metal. In between two metal is a specialized plastic which can last very long. So after that, we are keeping both ligaments, the other ligaments intact except the front and the back ligaments. So the side ligament, we are keeping your original ligaments. So after that, you can actually bend your knee. Even straight after the next day of surgery, you can bend your knee. You can walk the second day of the surgery. So it's actually proven to be a very effective way to treat osteoarthritis. The aim of total knee replacement is to relieve the pain and provide improvement in function. So usually we will advise total knee replacement in osteoarthritis knee patient when they have a severe pain, and this severe pain already affecting their daily activity of living and already retarded their function. This is actually not an age matter, but we take a more elderly patient age group. That's because although have a lot of improvement in terms of technique and technology in the total knee replacement, but until now we still only can achieve around maybe 90% of revision. 90% of revision rate in 20 years means the longevity of the implant is about 20 years in 90% of patients. So we tend to do the surgery in a older age group so that the implant can last longer, then we don't need to come in and do a revision again. And second group of patients is when they have severe pain. severe pain until they stop doing what they like. A 55 years old, 60 years old housewife, they like to go out with having dinner and weekend plan with families. If let's say the knee pain is already affecting her, she refuses to go out, just stay at home, and she want to make some changes. She want to go back to her normal usual life. So we will do the knee replacement for her. Basically, it's a knee replacement surgery. It takes about 1 hour to 2 hours of surgery. You usually will be admitted 1 day before. Usually, it will be done in a half body numbness, or it can be do under general anesthesia. The surgical day itself, you'll be advised to lie on the bed to rest first. So the modern technique and modern technology has allowed you to actually weight bear and walk on it the second day, the very second day. So the day after the surgery, you are encouraged to walk with a walking frame, and then to weight bear, and we will encourage you to bend the knee. Try to get about within a few days to get about 90 degrees at least. At least you can sit at the edge of the bed. And early mobilization, early walking can also prevent a lot of post-surgery complication, like lung infections, like deep vein thrombosis, like a pressure sore. Basically, early walking can improve the circulation and improve your general well-being. The wound will heal between like 10 days to 14 days. Most of the time now, you don't need to remove any suture, and during the 10 to 14 days, some swelling will be there. You're advised to elevate and then put ice, and then at home. Usually you stay in the hospital for about 2 or 3 days. Once you're able to use confidently with the walking frame and you're able to bend more than 90, you're allowed to go home. And within that 2 weeks, you can mobilize it at home. Most of patients will allow to like go outdoor, start driving about 4 to 6 weeks. And if you plan to go back to your previous occupation, and usually it can be done after 2 months. And if you plan for a holiday, or you plan to do another replacement on the contralateral or the other knee, usually advisable about 4 months.